Somali mother Hasha Abdullahi became desperate when 3-year-old Abdisalam started to refuse his food and showed signs of being malnourished. Life was difficult enough for her, living in a makeshift camp for the displaced in Somaliland with her 7 children. Help came in the form of a community worker who suggested Hasha buy some sachets of Super Fariid, a micronutrient powder, to sprinkle onto Abdisalam's meals.
My son became sick and very weak. He even stopped playing with his friends because sometimes he would fall down. I gave him some medicine, but his condition did not improve. Since I was introduced to Super Fariid, he has gained his strength back, and when you look at him, he is fine.
Now a healthy Abdisalam accompanies his mother to buy micronutrient sachets at the nearest pharmacy. She puts the powder on his food once a day. It was health promoter Kusta here from UNICEF's partner PSI who told Hasha about the Super Fariid sachets. She goes from house to house, educating mothers on child health, including the need for children's diets to include essential vitamins and minerals, and warning of the risks of malnutrition, illness or blindness.
When we visit these mothers, we do not only talk to them about the importance of micronutrients, but we advise them on exclusive breastfeeding for children below 6 months. We also advise them on best food to cook for their children, including vitamins like vegetables. We also teach them home hygiene and sanitation habits because all these things are connected to keeping a child healthy.
However, even when the mothers understand the importance of micronutrients, they often can't afford to buy the kinds of food that make up a well-balanced diet. And that's where the subsidized sachets of micronutrient powder, which cost just 35 cents for a week's supply, can help. Each sachet has enough iron, vitamins A and C, zinc and folic acid for a child for a day, and can be sprinkled onto food during cooking or just before eating.
It is affordable. Even when you don't have the money, you can easily borrow from a friend. My daughter is using Super Fariid every day. If you saw her before, she was very weak and could not stand or sit down, but she's okay now. This is the first month since she started using it.
UNICEF supports the project and supports PSI to carry out social marketing to raise awareness of the micronutrient powder using television, radio and roadshows. As the public healthcare system is limited, using local pharmacies makes the sachets far more widely available.
We always realize that when you give products for free, that at the end of the day mothers are not using, and this came back to the market because of they don't value it, and that's why we are making products to be selling. And this selling is not expensive to them. We always conduct what we call willingness to pay study. So willingness to pay study is basically asking mothers how much they can buy for this product. So from the findings of that study, then we design the price structure accordingly.
Currently, Super Fariid is available in Somaliland and discussions are underway for expansion into Puntland. There's much work to be done to tackle the causes of malnutrition, which affects over 200,000 children in Somalia. Ensuring children and their families get the micronutrients they need is an important step towards ensuring children remain healthy. This is Susanna Price reporting for UNICEF Somalia. For more information, go to www.unicef.org. Unite for Children.